Hello everyone, moving to the next module, we have got to talk about the negative history. Now, in the HOPI, like I told you, you have to tell it like a story, you have to frame it like a story, and in the story, you will mostly be talking about the positive findings. If necessary, you will be talking about few of the negative findings, like it is not relieved by or it is not aggravated by. But apart from it, HOPI has got to be the most important positive finding thing that you can tell your examiner. But equally important with the HOPI is the negative history, because now you're going to be ruling out the conditions that you have in mind. A lot of the time, students are not able to recognize what is the relevant negative history that we have to ask for. So I've given you a list. You can download it also in the description. And using that list, you can write down the negative history of each particular condition. The negative history will give you two or three things. HOPI and negative history, if you combine, you will be able to narrow down the disease to three different levels. First is anatomy. That means what is the system, what is the organ is the disease originating from. So in our case discussion, we came to know that it is originating from the liver. Secondly, the etiology. So what is the etiology? We were thinking that it is probably viral in origin. And lastly, what is the pathology? That means what is the name of this disease? So this is viral hepatitis that we are talking about. So this is the basic idea. With positive history of HOPI and negative history combined, you will get anatomy, etiology and pathology, which you absolutely must have. Negative history has to be mentioned. You can take as many negative history as you want. You can take an entire page of negative history, because ruling out diseases is something which we have to do. But always make sure that all the relevant negative history you are presenting first, and then all the irrelevant ones which you are just writing to fill the page. Some examiners love a lot of negative history to be included in their examinations. Some examiners don't like that much no. So it depends on what kind of an examiner you're facing. But in real life, you can write as much negative history as possible. It's very good that you are ruling out all the different conditions, because that just shows that you know these conditions that you're ruling out. So without any further ado, let me tell you a few of the negative histories with respect to each system that you must elicit, right? When we talk about CVS, if you have to rule out, you can talk about no history of chest pain, no breathlessness, no palpitations. These are the few things with CNS with respect to CVS that you have to talk about. Next, we go to the RS. So RS we've got most importantly history of fever, history of cough, history of breathlessness. CVS and RS are very linked together. History of allergy, history of wheezing, that is sounds coming out when you're breathing, history of stridor. So these are all the negative history with respect to RS. With respect to the CNS, very essential to rule out CNS in every single disease, because CNS is very commonly involved even in diseases outside of the CNS. So we've got history of fever, we've got history of headache, then we've got neck stiffness, vomiting, nausea, weakness, gait abnormalities, vision abnormalities, taste abnormalities, hearing abnormalities. So CNS can involve literally anything. Per abdomen, that is the GIT, you have to essentially rule out nausea, vomiting, loose stools, constipation, abdominal pain, fever, rash. All of these are important. With respect to the musculoskeletal system, you have to rule out if there is present of joint pain, if there is particular joint swelling. Next, do you have skin rashes present? Because a lot of the rheumatic conditions have skin rash associated with it. For hematology, you have to rule out the anemia, that is the fatigue, tiredness, which is commonly present in a lot of conditions. You can also write about fever, which will give you the history of basically WBCs going down or going too high. In a case of leukemia, when the WBCs are too high, again, you will get infections because those WBCs are ineffective. You also have to rule out about the rashes. So these rashes will be petechiae, purpura, and ecchymosis. These are the different photos of it, and this will tell you a bit more about the hematological system. For endocrine system, you can talk more about the diabetes and the thyroid issue. So you can talk about there is no history of neck swelling, no history of palpitations, no history of tremors. In hyperthyroidism, that is the case, no history of swelling. So that will rule out the myxedema and the Graves pretibial edema that is present. In DM, you can specifically talk, my friends, about urea, polyphagia, and hyperglycemia. So no history of frequently micturating, no history of drinking a lot of water, no history of eating a lot of food. So this will rule out diabetes mellitus for you. So these are just the few of the systems that we read in medicine. And infective disease obviously will rule out by the most important history, that is fever. You can also rule it out by looking forward to the mosquito bite as well as the insect bite, or particular small rodent bites can also be present. So these are various negative histories that you can use in your entire examination that will put a charm to your examination and make you rule out a lot of diseases, and it will narrow down your anatomy, your etiology, your pathology. So whenever you're doing HOPI, negative history is equally important. Please combine it very well. Now specifically, I want to talk about an example of how negative history can be very essential. If a person comes to you and if he says, I've got maybe a headache and I've got fever, but at the same time I do not have knuckle rigidity. So you might be not thinking in terms of meningitis now, because the knuckle stiffness is not present. Headache and fever is a common complaint of even pneumonia. So that way negative history can help you rule out certain conditions. So I hope I've made it very clear on how to write the negative history. Again, you can check the link in the description, and this will give you all the list of the negative histories that you can write in different conditions. Please make sure that you are practicing HOPI and negative history for each individual case, and you're making a notebook. In that notebook, you're writing down all the cases with HOPI and negative history, because my friends, this is where the examiner is going to be actually judging you. Before you go to the examination with the negative history and HOPI, you should be able to rule out anatomy, etiology, pathology. If you are not able to get to anatomy, etiology, pathology, there is something wrong with the HOPI app or the complaints of the patient. You are taking the irrelevant complaints. So with that, let's move on to the next module.